Hey guys, how are you all doing? Today we'll be studying something about respiratory and metabolic acidosis as well as alkalosis. These two terms have been very confusing in my UG days. Respiratory and metabolic. Now, before starting that, we should first know what is the basic difference about these two terms. So, we'll be trying to know what is the normal pH of the blood, the working range that ranges from 7.35 to 7.45. That is the normal working range of the blood. So if the pH falls from 7.35, that is called as acidosis, and if it is above 7.45, that is alkalosis. That's right, done with that. Now before starting that, we should first know about this equation that carbon dioxide binds with water to form carbonic acid, and carbonic acid, it dissociates into the ionic forms, which is hydrogen and bicarbonate. pH is related to H plus ions. It is also related to carbon dioxide and bicarbonate ions. Now, when we talk about respiratory acidosis or when we talk about respiratory alkalosis, we will be keeping this in mind. Whenever we're talking about respiratory, we will be talking about the first part of this equation, which is carbon dioxide and water. Okay, and when we're talking about metabolic alkalosis and acidosis, then we'll keep this thing in our mind that we'll be talking about the ionic forms. We'll consider the presence or the absence of the ionic forms, right? Okay, all right. Now, when we're talking about respiratory acidosis, there is an increased amount of carbon dioxide. Increased amount of carbon dioxide causes the reaction in a forward direction, which leads to increased dissociation and increased H plus ions. Carbon dioxide increases, H plus ions increase, therefore pH decreases, and pH decreases causes acidosis. Has to be respiratory acidosis. Now, when we talk about alkalosis, the carbon dioxide, the amount of carbon dioxide which is present inside us, it decreases. Okay, and if it decreases, the reaction is going in a backward direction, or it is not going in a forward direction in that speed. So the amount of H plus ions will decrease. Carbon dioxide decreases, H plus ions decrease, pH increases, and if pH increases, that is alkalosis. It has to be respiratory alkalosis. Alright, done with that. Easy and simple. Now, let's talk about metabolic acidosis and alkalosis. For acidosis and alkalosis, we'll be keeping this thing in our mind that we'll be talking about bicarbonate ions. If the amount of bicarbonate ions increases, then it binds to all the free H plus ions, and therefore the net H plus ions, the free H plus ions, they decrease. They drastically decrease. This is not acidosis, this is alkalosis, because if CO3 minus ions increase, H plus ions, the free H plus ions decrease, and if H plus ions decrease, that will cause pH to increase. And if pH increases, that is not acidosis, but definitely it has to be alkalosis. And what kind of alkalosis? It is the metabolic alkalosis. Now, let's just move on to metabolic acidosis. What happens if the bicarbonate ions, they decrease? There is a decreased excretion of bicarbonate ions, or maybe there is increased excretion of bicarbonate ions, therefore the bicarbonate ions decrease, and there is increased H plus ions, the free H plus ions, they increase. They don't bind to H plus, HCO3 minus, and therefore H plus ions, they increase, which causes the pH to decrease, and therefore acidosis. Has to be metabolic. That's it for today, guys. Hit the like button if you like the video, and thank you very much for watching it.